In breast augmentation, the surgeon, or in this case myself, I have the opportunity to not only augment the breast and give somebody an augmentation, but to correct some subtle asymmetries that every single woman has. So essentially, it is a great opportunity to excel as a surgeon by bringing the patients more symmetry. And that could be done right at that moment. So it's not just simply putting a balloon and inflate it, or just putting a silicone implant and throwing it after I make a pocket. The pocket has to be done delicately, has to be done precisely. It can't be too big, it cannot be too lateral, it has to be done perfect. Then the implant, when it's inserted with a no-touch technique and a sterile technique, but then at that time, corrections are made to preserve and to improve asymmetric breasts. In choosing incision for breast augmentation, that's very important. If I were going to do the same incision to every single patient, I will make about 85% of the patients happy, and 15% will be very unhappy. That is a very high number. I can't do that. So a breast augmentation surgeon needs to be well versed in all types of incision, whether it's transaxillary, whether it is periareolar or inframammary incision. So we don't talk about transumbilical because that I don't do and nobody does that anymore. But those three approaches to the breast, any good breast augmentation surgeon needs to be very well versed on those, period. So you choose, depends on the patient, depends on the incision. If you have a breast that is completely flat, that there's no inframammary fold and very small areola, then obviously you can't do an areola incision, you can't do inframammary because there's no fold. So in that case, a transaxillary incision, it will be ideal for this patient. If you have a patient that has a very well-developed fold and you're going to do changes, for instance, you're going to do suture a pocket, or you're going to do changes because you're exchanging an implant, that will be a perfect approach for that. Now, if you're doing a lift, then might as well go through the areola because you're going to go through the areola anyway and the incision is going to be there. So the most important thing besides incision is to have a gentle technique and minimize scarring by doing a minimally invasive, gentle technique.